I'm so glad to be playing a small role in helping to recognize the stellar program known as iCare. Mental health, especially in South Carolina rural communities, is an epidemic problem, exacerbated because of lack of access to transportation, not to mention the number of professionals, providers in our rural regions. So by using telehealth, we're actually able to bring the provision of mental health care rather than expect someone to come to Columbia or Charleston, wherever it might be, to actually bring the care, bring the evaluation, and bring the treatment right to them.
The iCare psychiatry program has been around for almost a decade. It was designed to help deliver and meet mental health care gaps in rural, underserved areas of South Carolina. And it really has been an incredibly successful program. What it does, it prevents readmissions for folks that might be seen in an emergency situation, especially in behavioral health or mental health issues. We don't have enough mental health staffers now or anticipated in the future because of the shortage of those type of professionals. If we can get patients that need to be followed up after being seen in an emergency room in a very short time period, they can do it through telehealth versus in person. They can get seen in follow-up and markedly reduced readmissions to the healthcare system or revisits to the emergency department.
The state of South Carolina has seen, over the last 2 years specifically, an enormous increase in the demand for mental and behavioral health resources. When we don't have programs like the iCares program, those resources are sought out in our emergency departments, and it makes complex care that's not behavioral health compromised because the ERs get overrun. What this program does is gives access, routine access, to folks all across the state that wouldn't have access to this care and keeps them out of the emergency departments, leaving those resources there for the citizens of South Carolina when they're needed.